Hi, I'm Amanda.
And I'm Taylor, and we're going to tell you a little bit about the client that we made up.
So our client has muscle tension dysphonia, and she is a 45-year-old school teacher.
She currently complains of a hoarse voice, tightness, and even muscle aches in her throat, and sudden breaks and fading off in her voice. So while she's teaching, her voice breaks. And then her neck feels a little tender and sore. She has a loss of vocal range and feels like she needs to clear her throat a lot. And sometimes she feels like there's a lump in her throat. So that is our client. So for our client, we decided to do some physiologic voice therapy. So the first therapy technique we're going to do is called vocal function exercises. And this was developed by Joseph Stempel. And it's used to help patients with hyper or hypofunctional voice disorders, phonation, and resonance. And through this, we have a few directions, and then I'll show you how we do it. So first we're going to begin with a warm-up. So I'm going to ask the client to sustain a vowel, and then I'm going to chart for how many seconds they sustained it. Then the second step is a stretching/glide step. So that is where I'm going to have the client start at their lowest pitch or note, and then go to their highest pitch or note. I'm going to give them a word to do, one for a tongue trill and one for a lip trill. And then we're going to go back the other way for the next step called a contracting glide, and that's from high to low, and I'll be doing the same thing. And then for the fourth step, we'll do an adductory power sustain, the musical notes for as long as possible. So we're going to do the sound O for as long as she can hold it. So as we do this therapy technique, I'm going to give some feedback to the client. I'm going to make sure that she has water and that she has good posture and her breathing is regular, and that she tries to maintain the same tone so her voice isn't breaking or she doesn't get into any glottal fry. Okay, are you ready?
Mm-hmm.
Okay, so now I want you to hold the vowel E for as long as possible.
E.
Okay, I'll write down how many seconds that was. Okay, next I'm going to have you say the word knoll, but we're going to start with your lowest pitch to your highest pitch. So like this. Knoll. And that's called a tongue trill. Okay, ready? Now it's your turn.
No.
Good job. Okay, next we're going to do the word whoop. And we're going to start with your lowest pitch to your highest pitch. Good. I'm glad that you're drinking water. Okay, so this is whoop. Whoop. But hold the P.
Whoop.
Good job. Okay, next we're going to do a contracting glide. So this is going to be from high to low. So we're going to do the word knoll again. So, knoll. Okay, your turn.
No.
Good job. Okay, and now we're going to try the word boom from the highest pitch to the lowest. So, boom, and hold it.
Okay. Boom.
Okay, good job. Your voice fluctuated a little bit there.
It felt weird at the end.
We can try again. Okay, ready? Start up high, boom,
Boom.
and low. Hold it. Good job.
It felt better that time.
Good. Okay, and the last step is called an adductory power sustain. So I'm just going to have you hold the sound O for as long as possible.
Okay.
And we're going to stop anytime if I hear a voice break or anything like that.
Okay. Oh.
Good job. I'm going to write down how many seconds that was. Okay, and so that was our vocal function exercises.
Okay, so we are going to be doing the laryngeal relaxation with circumlaryngeal massage and reposturing techniques. So how this works is the first thing you're going to do is you're going to find the thyroid notch and move superiorly, finding the hyoid bone, and place direct pressure on the two major parts of the hyoid bone, so like right here. And from the thyroid notch, you'll move superiorly, finding the superior cornu of the thyroid notch and apply pressure. And then the next thing you're going to do is, from the thyroid notch, move laterally to feel along the anterior side of the sternocleidomastoid muscle, then move up to palpate the submandibular muscles. So after that, you are going to find the thyroid notch and apply traction, pulling the larynx down during vocalization to determine if there is improvement in voice quality. If voice quality significantly improves, then repositioning may be a key factor in remediating the patient's dysphonia. Hi, I'm Amanda. I'll be playing the clinician.
And I'm Taylor, and I'm Amanda's client.
Okay, so let's sit up straight. Let's get good posture, okay? So I'm just going to do some massaging. Hopefully it feels some less tension.
Mm-hmm.
Okay. Okay, can I have you turn to the right, please? Okay. Now to the left. Okay, now I'm going to have you look forward, and I'm just going to have you hold out. Okay. I'll be done.
Okay, so I'm going to explain one of the counseling techniques. The counseling technique that I'm going to do is called affect response, and this is where I listen to my client, explain what they're feeling. After I just told them what their disorder is, I make sure that the environment is comfortable, non-judgmental, and let them express all their feelings, even if it's negative. So I'm just going to listen to what they say, and then I reflect it back to them, so just to make sure that they feel like they're being heard. Okay, so we're going to begin.
Hi.
Okay, so now I just gave my client her diagnosis, and she's going to tell me about her symptoms, how it's affecting her life, and we're going to go from there.
So I definitely knew something was going on, so this isn't a huge surprise, but it is a little bit upsetting because I don't feel like I'm that old yet, and I don't think I should be having voice problems, especially because being a teacher, I have to talk all day. Mm-hmm. So I don't really know, like, if this is going to affect my job because I have a family, I can't not work. So I just kind of need to know, like, going forward that I know it might not be able to get totally better, but just that with therapy, it'll hopefully not take me away from what I love to do. Mm-hmm. So, I mean, it's upsetting, but I definitely think that hopefully it'll all be okay.
I mean, I get how this can kind of come as a shock to you, and I know you said you feel like you're young and that you're not old and this shouldn't be happening to you, and just remember that this happens to all ages. Just with the job you have and using your voice more often than other people, this is why, or could attribute to why you got this. So if you ever feel bad or guilt about it, we don't want you to. We know that's like part of the process to make you feel better and get better, and so that way you're able to go back to what you love doing.
Okay, so now we flip-flopped roles, and I'm going to be the clinician, and Taylor is going to be the client.
Mm-hmm. And she just told me my disorder.
Yes.
Okay, so yeah, I don't know, other than just being a school teacher, I just feel like when I'm at home and my voice breaks because I've been using it all day, and then my husband can't hear me, and then when I want to talk to my grandkids, my voice gets really soft and I can't really talk, and then they just become disinterested and go away, and I feel I don't know, I know I have support at home, but no one's just hearing me out, and I'm glad I'm here and sought help, but just in addition to doing what I love, being affected, and then the people who are around and who I love, kind of that also being affected too.
Definitely. I know that must be hard, especially just because you want your loved ones to always want to talk to you, always want to be around you and all that stuff. And I personally love to be around my family too, and just be uplifted by them and be heard by them, not just hang out around them and feel like you can't talk and your voice isn't heard because you talk too quiet or your voice is getting hoarse at the end of the day. But I want you to know that I go through the same things at home. So I'm a speech pathologist, so I use my voice all day. So I can't say that it's going to be easy, but I can tell you that we're all kind of going through our own things on our own, so it's gonna get better, and we'll be here for you along the way. So I just demonstrated the sharing self counseling technique, and that is basically where you're just showing that you're a caring and compassionate human being, and you understand where their feelings are coming from, and through this you kind of get a deeper relationship with your client. So you're just showing them that like you're a person too. You're not just someone who's helping them through, like you go through things, and everyone kind of needs someone to lift them up sometimes.